This section of the respiratory system chapter is going to consider how breathing is regulated and some health concerns in regards to the respiratory system. The book includes the first figure I'm going to look at within the ventilation section of the chapter because it's addressing how breathing is controlled. But I'm leaving it here for regulation because I also want to consider some other aspects of how breathing is regulated. Also, I want to address a couple of things relevant to the respiratory system that have to do with health concerns, namely smoking. There are 4 centers in the brainstem that control most respiratory function, 2 in the pons and 2 in the medulla. In the medulla, the dorsal respiratory group is the nucleus that's primarily responsible for controlling basic breathing. Autorhythmic neurons in that nucleus will send action potentials on a regular basis to the diaphragm and the external intercostals, causing contraction, therefore enlarging the thoracic cavity and the lungs so that air can rush in. Those muscles will relax, and with the recoil of the elastic tissue in the lungs, everything will get smaller and air will be forced out. It's basic breathing. The ventral respiratory group controls muscles of inhalation, like the abdominals and the internal intercostal. And it gets input from the dorsal respiratory group when additional contractions are needed to control inhalation. The pontine regions are called the pneumotaxic center and the apneustic center, which influence the medullary nuclei I just described. The apneustic center will drive the dorsal respiratory group as an outside source when needed, and will increase breathing, such as when we need to hyperventilate or regulate blood carbon dioxide levels. The pneumotaxic center largely acts as a foil to that, to decrease the activity of the apneustic center. All of this can be modified even further by descending inputs from the hypothalamus for various homeostatic mechanisms, or even from the cortex for voluntary control, especially with, say, speech control. A condition that the respiratory system has to help maintain through homeostatic mechanisms is blood pH. Now, the relationship of carbon dioxide and carbonic acid and bicarbonate and all of those things to the blood pH is directly about high levels of carbon dioxide relates to a low blood pH called acidosis. Acidosis causes many problems around the body, and the way to control that through the respiratory system is to increase exhalation, to get rid of more carbon dioxide if possible. And by doing that, we'll also be bringing in more oxygen since the two processes are tied together through ventilation. But we really directly control carbon dioxide levels in the blood, and we can hyperventilate to breathe faster and force more carbon dioxide out of our body if need be. Acidosis might be the result of disease states, but might simply be a mild reaction to exertion as we build up lactic acid from muscle contraction that can change the blood pH. I want to consider another health concern, which is the drop-off of respiratory function with age. Here we see a graph of the declining respiratory function measured by a test called forced expiratory volume, measuring how much air somebody can exhale in the first second when they're forcing all of the air out of their lungs. At 25 years of age, there's going to be a common number there, and that declines as somebody gets older. For a non-smoker, the decline is not insignificant, but not going to get to a level where there's any clinical manifestation, any symptoms associated with that. But for smokers, there will be a change. Now, they have 2 lines here for susceptible smokers and severely susceptible smokers. There are people that react to the problems with smoking differently. But in both cases, clinical symptoms will develop at some point because of the increased decline of respiratory function due to smoking. If somebody stops smoking, and there's a dotted line in here that suggests somebody doing that at 40 years of age, then the decline that we see with age will change its slope, so to speak, and the curve will look more like the average non-smoker, just displaced based on how depressed the respiratory function was at the time of quitting. The earlier somebody quits smoking, the easier it is to get to the point of having decline mirroring the average non-smoker. Let me end with this visual that shows a healthy human lung next to a lung that's been recovered from a smoker's body. And you can see there's some very significant changes to the tissue thanks to the effects of smoke on the lungs. Consider this question. When you feel that you've reached an answer, hit the next button to go into the next slide, which will reveal the correct answer. Again, in the medulla is a dorsal respiratory group, which is autorhythmic and sets up the basic respiratory rate, controlling the external intercostals and the diaphragm.